Hey there, it's Dave Hompes again, and I'd just like to say a big thank you for taking an interest in the Hompes method, in the training, and in my work. I really appreciate the fact that you're here, spending your time watching these videos. I'm going to add and build a picture about Hompes method over the forthcoming 4 videos, plus all the bonus lessons and things that I promised you as well. But this is the core of what Hompes method is about, the system that I've developed in clinical nutrition and functional medicine to help people get great results and rejuvenate their health, as I said, in what we call the 7 areas of health. So this first video is all about the 7 areas of health. And what I'd first like to say is that with the Hompes method, I don't like to really work with people who have very serious diseases. You know, things like cancer, advanced heart disease, nasty type 2 diabetes, neurological conditions like multiple sclerosis. They are best left to the specialists. What I do with the Hompes method, and what I'd really love to teach you, is I help my clients and patients get results and improve their lives, their quality of lives, etc., in areas of health that the medical system doesn't really have a label for, and where people are not too dysfunctional in the sense that they're feeling really, really unwell, and we're not then seen to be treating diseases, because we can't do that as unlicensed practitioners. So the Hompes method really is about helping people with these 7 areas of health rather than trying to focus and treat diseases, chronic diseases. Now, the principles that I teach can help people who have those really nasty diseases, but that's not where my experience lies, so it would not be right for me to try and teach you about that work. And what you're going to find is, and what you probably already find if you're a healthcare practitioner, is that there are tons of people walking around with a whole kind of hodgepodge or mishmash of symptoms, and the medical system can't diagnose those symptoms. I, for example, had heartburn, irritable bowels. It felt like my digestive system was kind of like a washing machine all swishing around in there. I had low energy. I was feeling anxious and depressed at different times of the day. I wasn't sleeping well. I had skin problems like dandruff and athlete's foot. And my sex drive was on the floor as well. Now, if you go into a doctor or any clinic and complain about those symptoms, list those symptoms, there's no medical label that can be placed and hung on you for having a mixture of symptoms like that. And yet there are millions and millions of people walking around in that exact situation and with that predicament. And they're confused and they don't really know what to do, and the doctor doesn't really know what to do. And that's no fault whatsoever of the doctor. The doctor's not trained to deal with that mishmash of symptoms. The doctor's trained to hang a specific diagnosis on a specific complaint that a patient is experiencing. But when you have digestive problems, energy problems, mood problems, aches and pains in your body, your menstrual cycle is off, or for a man, you know, you can't get an erection or sustain an erection, all these different things, they don't know what to do, can't give different drugs for all these different conditions. Now, what we do is in Hompes method is we basically help people find out why they have symptoms in these 7 areas of health. So let's just have a look at them in a little bit more detail. First of all, we've got digestion. I personally don't believe that a person can be healthy unless the digestive system is working properly, because the digestive system is an interface between the outside world, the food and water that we put in there, and the air that we swallow as well, and the inside world, which is our body. Digestive tract itself starts in the mouth and goes all the way down to the anus. It's really a long convoluted tube that goes straight through the body, and you might say that it's not even part of the body. So when we're eating food and all the other things that go in with the food, and when we're drinking water, it's the job of the digestive system to decide what goes in and what gets neutralized and is surplus to requirement and gets passed out. So if the gut is not working properly, we end up not getting enough good stuff into our bodies to help it work efficiently, and we end up potentially with a whole bunch of bad stuff getting in that can cause a massive amount of disruption. And in the next video, not the next one, the one after that, video number 3, we're going to talk about that bad stuff and good stuff seesaw in a lot more detail, and you'll see again why the gut is so important. And what kind of symptoms do people have? Well, we're not talking about bowel cancer or stomach cancer. What we're really talking about here is, from top to bottom, things like acid reflux, heartburn, bloating, feeling like people walking around feeling like they're 6 months pregnant. We're talking about excess gas at both ends, burping and belching, and then wind at the other end as well. We're talking about loose stools and diarrhea. We're talking about abdominal pains and cramps. We're talking about constipation, where people are not going to the toilet, maybe once every 4 days or 5 days, and not getting rid of their waste properly. They're the kinds of digestive symptoms that get lumped together as irritable bowel syndrome, IBS. I personally feel it should stand for intestinal bullshit, because really there's always a reason why the gut is not working properly. And when the gut's not working properly, as I said earlier, you get a whole bunch of bad stuff getting into the body, and the good stuff that you're supposed to be getting from your food doesn't get in properly. So you end up with this imbalance in the good stuff and the bad stuff, which then has a knock-on domino effect and has the potential to create problems almost elsewhere in the body. The next area of health that people are concerned with is their reproductive health and their sex lives. So reproductive health is more than just sex drive. It's more than just being able to, for a guy, getting an erection and sustaining an erection. It's, for example, in a woman, related to the menstrual cycle. It's related to how she feels at different times of the menstrual cycle during the first half and the second half. Does she get, again, PMS? Like IBS, it's a syndrome. Irritable bowel syndrome basically means we know there's something wrong, but we're not quite sure what it is, so we'll give you this label. It's the same with ladies who have challenges around their menstrual cycles. So sexual health goes way beyond just sex drive, although it does include sex drive, into menstrual health and possibly menopausal health, things like andropause in men as well. Energy. One of the things that I ask all my clients when I start to work with them is, if I took away your willpower, how much energy would you actually have on a day-to-day basis? Most of them stop and think, actually not that much. Willpower drives them because they feel they need to go to work, they need to look after the kids, they need to do that, yada, yada, yada. Actually, they don't feel energized at all. They actually feel flat deep inside. And energy levels can be low, just as the reproductive system can be imbalanced because of hormones, nutrient deficiencies, a constant immune response against bad bugs in the gut, and all these other things that I talk about in the Hompes method training. The fourth area of health is aches and pains. Chronic aches and pains. Muscle aches, joint pain like arthritis, even things like headaches, and just chronic niggly pain that people kind of think, well, where's that come from? Why is that happening? Again, unless there is a mechanical problem, a structural problem, the aches and pains are usually due to too much bad stuff being in the body and not enough good stuff. That creates an inflammatory response, and the inflammatory response drives not only the pain, but also many of the other symptoms that we see in the 7 areas of health. At number 5, we have mood. We have people walking around feeling low without any particular reason, feeling a bit depressed and down, even when life is good. We have people feeling anxious, like I was. We have people feeling irritable. With women, these mood changes can be affected by the menstrual cycle, or people can just have these mood imbalances really flat. The mood can be caused by hormonal imbalances, nutritional deficiencies, inflammation, and changes in neurotransmitter function as well. And a little bit more insidiously by things like heavy metals, mercury, arsenic, lead, cadmium, and what have you. Then we move on to sleep. It's very rare for me to come across a client who's sleeping soundly. People have a hard time getting to sleep. People have a hard time staying asleep once they are asleep. And in some people, they may even be getting only 1 or 2 hours a night. There are some really basic principles that often help to restore a good night's sleep that I'd love to teach you about in the program. And again, if you look at the bad stuff, good stuff seesaw, it's usually a consequence, or poor sleep is usually a consequence of too much bad and not enough good being in the body. And then finally, we have kind of the outside stuff people are worried about from an appearance perspective. We've got the skin, we've got the hair, and we've got the nails. Women in particular are really concerned about their hair and nails, but more and more guys as well. And when I was feeling, pretty under the weather, I had dandruff and it was really embarrassing. I had athlete's foot. It was really embarrassing. And people can have eczema, they can have psoriasis, they can have dermatitis, hives, rosacea, acne, all these different symptoms. And that's usually a reflection of stuff that's actually going on the inside of the body, particularly related to the gut, particularly related to the liver and detoxification, and also the balance of hormones as well. Now, what we do in Hompes method is we have a two-tiered, a two-level structure that you'll learn more about in the forthcoming videos, whereby from a foundation of solid nutrition and lifestyle, we're able to get people moving very much in the right direction. In fact, in some cases, that's all that's needed. The Hompes method functional medicine system comes into play on top of the nutrition and lifestyle recommendations. It's a little bit like a Rolls-Royce service, whereby we're able to run specific tests to find out what bad stuff is in the body, what good stuff is inadequate and missing, or what is out of balance, to then be able to laser target and laser focus healing and rejuvenating protocols to help people restore health and vitality in all of the 7 areas. So we're not treating specific symptoms, we're not treating disease, we're not diagnosing anything. What we're doing is saying, look, I can help you optimize your health, certainly rejuvenate your health in these 7 areas of health. There's one area of health that's missing here, and that's weight management. I don't tend to work with my clients with weight management. The reason is, if they're underweight or overweight, it's usually because of all of this stuff is out of balance as well. The digestive system, the hormonal balance and what have you, tends to create the scenario in which weight management problems develop. By correcting the rest, the weight management problems normally resolve themselves anyway. So I hope you've enjoyed this first video. In the next video, we're going to talk about a concept called the vitality scale and how health and illness are not black and white. They're on a continuum, how you can teach your clients and patients that no matter where they are on that continuum, there's always a way to go up and improve and ascend, rejuvenate their health and vitality. My name is Dave Hompes. We're talking about the Hompes Method Functional Medicine Practitioner Training Program for 2015, and I can't wait to see you on the next video. Thanks for watching.